Inside the stories that affect you. This is Inside KELOLAND.
Thanks for joining us for an Inside KELOLAND Health Beat special. I'm Don Jorgensen. This week we are getting an update from local health officials on COVID-19 in South Dakota. Just over 2 weeks ago, doctors from two of the state's largest hospitals joined the Sioux Falls health director in a call for action. New and active cases are back up to levels not seen since last winter. Also, a major concern is the number of people with COVID in South Dakota hospitals. Well, this week we are catching up with the leaders from Sanford Health, the Vera Medical Group, and the Sioux Falls Health Director. Joining me right now is Dr. Jeremy Cowles, Chief Physician for Sanford Health. Thank you so much for taking the time, Doctor. Where are we right now with this latest surge that we keep hearing about?
Right now, I think we're probably about a week or two from what we're predicting to be our peak. What we've seen is an increase, although not a violent increase, in the number of people that we've seen in our hospitals. Unfortunately, what we do know is that a majority of them, well over 90%, have not received any doses of the vaccine. And I think that, to me, is the most important part, is that there are still folks out there that could get the vaccine and avoid this unnecessary difficulty, illness, and suffering.
Earlier we were talking off camera, you were talking about this really is a battle of the pandemic of the unvaccinated. Explain that.
Well, I think right now where we're at is what we see is 90+% of the people that need to be hospitalized, that unfortunately go on to pass away, that need to be on our ventilators, all have one thing in common, and that thing is that they didn't go out and get a shot when it was offered to them. And it's my opinion that this makes this a pandemic of folks that are unvaccinated. Unfortunately, it's a pandemic of an unwillingness. It's no longer a pandemic of just about an illness because we now have a fix out there. We now have a solution.
And as long as we're talking about vaccinations, we haven't really moved the needle much here in South Dakota. Why is that?
Well, I can't say what the individual choices are for any person who hasn't gotten vaccinated. Whether they believe they don't need it because they're not convinced of the ability of the vaccine, or whether they don't think the vaccine is safe, or whether there are political reasons for them not taking it. I think all of those are out there. But the way I see it, this is an extremely safe vaccine that does its job extraordinarily well. And let me remind you that its job was to keep people out of the hospital and keep them from dying. And it does it in a way that regardless of your political ideologies or your other ideologies, can be done extraordinarily safely.
We were talking about this surge. Where is Sanford at right now in terms of hospitalizations?
Right now, we're at roughly 140 patients in the hospital as of yesterday morning.
And you were actually expecting, at this point, you'd be even higher than that?
We were concerned, as we were about 135 patients 2 weeks ago, that we'd be a little closer to 175 or 180. So I am happy to say that the work that everybody's been doing out there in the communities has allowed us to slow the curve down just a little bit. But considering all of our nurses, all of our healthcare workers, and the tireless hours they're putting in, I would love to see a couple more weeks of flatness or decreasing rather than growth.
And this past week, Sanford started doing weekly COVID briefings. Why do you feel that's important right now?
I think right now it's important for people to recognize that what we're doing isn't just taking care of a disease in the normal course of our business. What we're doing is really worrying about our people as well as our patients. We have nurses that have been going hard at this for 18 months. We have nurses and patient care techs that have been absolutely working at a blistering pace for the better part of a year and a half. And for them, the only way to take some of that pressure off is to make sure that we can control what we can control. And that is how many people are getting infections and to decrease the number of people that pour through their doors every day, through the emergency rooms and other places.
And your message to the people listening right now specifically has to be something towards getting vaccinated.
Absolutely. Right now, the best tool we have to prevent you or a member of your family from ending up in the hospital is the vaccine. We're here to develop immunity for everybody. And what I can tell you is, whether you've had COVID once before or you've never had COVID, getting another shot, getting the shot that's due to you, will absolutely make you more immune than you are today.
What do you say to the people who say, well, I've already had COVID, I don't really need a shot?
Sure. What I can tell you is in medicine, we call this hybrid immunity. I even saw a newscast the other day that called it super immunity. But the people who have had COVID once before and then go on to get a shot seem to have levels of antibodies and seem to have levels of infection-fighting ability that is probably better than even getting 2 shots and never having COVID. So if you've had COVID and you're waiting, the thing we can tell you right now is that your best defense for you and the person next to you is to go ahead and get that shot.
Doctor, what's your biggest concern now as we head into these winter months? When it comes to COVID, we're talking about the flu. Do you see anything out there that's alarming to you?
My biggest concern is that we could stack up RSV, which happens in kids, COVID, which right now happens in kids and adults, and influenza, which happens in kids and adults, to a point where we couldn't physically handle the volumes in our hospitals. And if we get to that point, I, as well as all of our caregivers, don't want to be to the point where we're stretched so thin that we can't give the best possible care to every single member of the people that need us.
And we've heard a lot about this new Delta variant attacking younger children. Is that the case?
It is absolutely the case. What we've seen both in schools throughout America, as well as where we are currently, is that the number of children getting this particular variant is increasing fairly remarkably. And I will admit it doesn't appear to be making an individual child any sicker. If you roll the dice and get that many more kids ill, what you're going to see is unfortunately that 1 in 10,000 kids or 1 in 1,000 kids get sick enough to be admitted to the hospital or possibly get admitted to the intensive care unit. And as we can all say, I think fairly safely, nobody wants to see a kid in the intensive care unit. And if we can prevent that, everybody's willing to do their part to move that forward.
And I don't know if you know the answer to that. How many kids do you have at Sanford Hospital with COVID? Do you know?
Currently, we only have 2, and that's a good number. We were up higher than that about a week ago. We had 6. So we'll go a little bit up and down throughout this. We're hoping to not be at the point like in Florida here a couple of weeks ago where I talked to a doctor who had 15 children's ICU beds, and all of them had been full for 3 weeks.
Wow, those are alarming numbers. Okay, Dr. Cowles, thank you so much for taking the time to be with us on this very important subject. We appreciate it.
Absolutely. Thank you for having me.
We're going to take a quick break. Coming up, we're going to hear from Dr. Edavera and what you can do to help fight the recent surge in COVID-19. Stay with us. Welcome back to Inside KELOLAND, a Health Beat special looking at the latest on COVID-19. Joining us now in the studio is Dr. David Basil with the Vera Medical Group. Thank you so much, Doctor, for taking the time to be here to talk about this very important subject as we head into the fall season. Just over 2 weeks ago, Doctor, you, Vera Health, joined Sanford and the Sioux Falls City Health Director asking for people to take action. Where are we right now?
So like you said, a couple of weeks ago, we really came to the public and said we've seen a rapid increase in cases and we're really starting to get kind of worried about this. And we've seen the public respond to that. We've seen an increase in people coming in, recognizing that when they've got cold symptoms, they need to get tested. People, increase in masking, some of those. We've even seen an increase in vaccinations. And so I think we're already starting to see an effect because the rate of increase has leveled off a little bit. Now the question is, are we nearing a short-term peak here again, or we still got a little bit upward mobility? And the concern is about this time last year we saw a little bit of a leveling off, and then we took back up yet again. And so the worries is that we've still got a little bit more upward space to go on numbers.
Yeah, along those lines, this time last year, we also saw a rising and didn't really peak until November. Are we headed down that same path, or are we doing the right things?
Most of the projections we're seeing at this time seem to indicate we'll peak a little bit earlier this year, probably sometime in October. And so I don't think it'll be as late, and we'll hopefully be coming back down by the time we get to Thanksgiving versus last year. But it all depends on how serious the public continues to take this. Can we continue to get some strong interest in people getting vaccinated? That will keep this under control and keep the numbers not going up much farther and maybe even turning it back down again.
A lot of questions about vaccination, obviously how important it is to get vaccinated to avoid what we saw last year. Some people are wondering if they've had COVID. Are they immune to it? Do they need to get vaccinated? Or should they go ahead and get vaccinated anyway?
Right. So what we are seeing is that the vast majority of the hospitalizations that we're seeing are in the unvaccinated population. There's no doubt that vaccination is working and is very effective locally. We're seeing a few breakthrough cases in like nursing home patients or the very elderly, but otherwise it's all unvaccinated individuals. And even seeing it in individuals that have had COVID last year, you know, like during our November peak. And so it seems like does being previously infected provide some protection? Absolutely it does, but probably not enough. And having the infection before and getting vaccinated is really effective, and that we're calling that super immunity. So those of us, like myself actually, I had it last November and then got vaccinated last winter. You know, that's really showing really high levels of protection there, and so by far the most protection. And so it really doesn't matter if you've been infected before or not. The recommendations are still strongly to get vaccinated.
Good advice. Let's talk numbers. Where is Avera at? We've seen hospitalizations and COVID numbers.
So we're staying pretty steady on COVID hospitalization, somewhere in that 65 to 70 patient system wide, with 10 or 15 in the ICUs. And probably the ICU patients are what we're most worried about, because those are the ones that tend to stay, you know, weeks or even months in the ICU. And so that's where the biggest strain is going to be in the short term.
Of those numbers, how many unvaccinated?
Somewhere around 80% or so, I would say.
Yeah, we're kind of hearing that on both sides from the hospital systems. 80 to 90% are unvaccinated. Are you concerned about the trend that we're on right now, or does it feel like we are getting where we need to be?
We're certainly moving in the right direction. So we've seen a big increase in people being interested in vaccine. I think this summer numbers were low enough that some of the people that hadn't gotten vaccinated yet thought maybe they'd gotten past all of the bigger numbers and they wouldn't have to go get vaccinated. But now with the numbers really going back up, we've had a lot of people who recognize, yeah, it's time, let's go get vaccinated. And especially with how much more dangerous Delta variant is, I think that's really raised the awareness of people. So we have seen, you know, an increase in people getting tested, people staying home when they have symptoms again, and so people have really been responding this fall.
Are you a little bit surprised that we have not quite seen the surge that you were anticipating, given the fact that we've come through Labor Day holiday weekend, and we've got schools starting across the entire state, we've got activities, sports, we've got concerts out there, we've just concluded the South Dakota State Fair?
It really shows us how much control we actually have as a general public over this, because this is about the third time now that we've seen numbers really start to increase, and we've come out and asked people to step up their game, you know, to stay home when they're sick, to get tested when they're sick, to get vaccinated, and all three times people have responded, and that's eased things back off again. And so we really are in control of this pandemic, and it's in our hands.
What is the message that you want to give out there to our viewers who are listening right now?
So we're not through this yet, but we are getting closer all the time. And the only way through it is vaccination. Whether you've been infected before, whether you've been holding out, now's the time to go get vaccinated, because that's the way that we're going to get back to normal and not have to be talking about this again and again. And
one last question pertains to booster shots. A lot of people want to know who should be getting a booster shot if they've already been vaccinated.
Right. So as of now, we are offering vaccinations, a third dose, to those individuals mainly that are immunosuppressed, immunocompromised. So if you're on a medication that suppresses the immune system, or if you have active cancer, those sorts of illnesses, those are the only individuals that qualify for the third dose of the messenger RNA vaccines right now. Actually, late this week, the FDA is going to have discussions on whether to open up boosters to people who have been vaccinated, say, 6 or 9 months ago. And so we're really eagerly watching those proceedings later this week to see what the latest data is showing and whether there's going to be additional populations that will get additional doses. But for right now, it's just the immunocompromised individuals.
Yeah, because we keep hearing COVID is here and it's here to stay. We got to learn to live with it. Would you agree with that?
Yep. I think it'll, you know, the best case scenario is this is going to turn into a seasonal flu type of thing that we see change a little bit year to year. But what we need to have happen is enough people get vaccinated that, you know, it's common colds that we're all getting rather than, you know, serious hospitalization and hundreds of deaths like we've been having.
And bring those numbers down. Dr. Basil, thank you so much for taking the time. We really appreciate you being here.
Thank you so much for having me, as always.
And we'll continue the conversation with the latest on COVID-19 just after the break. We're going to hear from the Sioux Falls City Health Director. Stay with us. Welcome back to Inside KELOLAND. We've just heard from doctors at two of the state's largest hospitals on the latest surge of COVID-19. Now joining us via Zoom is Public Health Director for the City of Sioux Falls, Dr. Charles Chima. Sir, thank you for taking the time. We appreciate it. Both Sanford and Avera say that the peak is still a few weeks off here in Sioux Falls. Where do you think we're at right now in the city?
Yeah, so we've been working closely with the health systems, keeping an eye on the trends. And one thing we've seen is that in the last 2 months, we've had a steady rise in number of cases and hospitalizations. But I think the good news is that hospitalizations have begun to stabilize a bit. So in the last 2 weeks in particular, we're beginning to see hospitalizations level off and gradually decrease. So we hope it continues to decrease and that things get better in the next few months.
Let me ask you this, Doctor. Sioux Falls has had several busy weekends with large events. We've had the Sanford International and the Denny Sanford Premier Center just hosted a sold-out concert. Are these big crowds concerning to you?
So with big crowds, obviously we want life to return to normal as much as possible, but we just have to see that we put the right precautions in place. So as much as possible, we encourage people to have events outdoors and to encourage, the crowd to keep social distance, do the, basic hygiene practices, hand washing and wearing masks when in close contact with each other.
Let me ask you this. How closely do you work with the mayor and maybe the Sioux Falls public school systems on some of these issues?
Certainly very closely. So with the school systems, for example, not just the elementary and the high school, we also work with the local universities to review their policies and the practices that they have in place. We provide support for vaccination campaigns. And, we've even provided testing services. So definitely we work very closely to see that we encourage them to adopt evidence-based practices to see that we are mitigating the spread of the virus.
What's the city doing right now to fight COVID-19? We know that there are no mask mandates in place other than maybe just the healthcare facilities.
So one thing we know for sure is that the way we get out of this pandemic is through vaccinations. The data is very clear and very strong to show that. So for example, some recent data points that people that are vaccinated are almost as 30 times less likely to be hospitalized than those that are not. So we know that long-term vaccinations are how we get out of this pandemic. So a lot of our efforts have been focused on how do we improve our vaccination rates. We're holding a lot of events, a lot of education sessions, answering questions and addressing concerns that people have around the vaccine. And we're seeing that populations that are vulnerable or that have less access to healthcare. So we're addressing issues of equity around the vaccine, and we're taking the vaccine to people and making it as convenient and as easy as possible to get a vaccine.
You held a public health briefing a couple of weeks ago. What's changed since then?
So one thing that has changed, as at the time we had the press conference, the cases, the hospitalizations were still on the increase. But like I pointed out, in the last 2 weeks, we've seen a slight decrease in hospitalizations. So we're hopeful it continues to trend positively, and we just watch and see what happens in the next few weeks. But again, we continue to encourage people to realize this pandemic is not over. What we do now determines, where we will be in the next few months. So if we continue to practice those hygiene measures, and those of us that have not gotten our vaccine, if we can get the vaccine, that will make things, go by quickly.
We keep hearing that that's the only way to beat this pandemic is to get vaccinated. What is the city doing to try to get that message out there?
So we're doing, we've been working, with partners, including the private sector, to get the word out. But also we are doing a lot of outreach events in the community. So as you know, we're doing focus groups. We're talking to committee members, trying to understand some of the issues around hesitancy around the vaccine. And we're making it very convenient. So we are working on having mobile vaccine clinic so that we can more easily bring a vaccine on site for those that have issues accessing the vaccine at healthcare facilities.
Okay. Any final thoughts, Dr. Charles Chima?
Yeah, I think we cannot say it enough to make people understand that the data is very clear, right? If we look at what is happening in the hospitals right now and in the ICUs, it is mostly those that are unvaccinated that are ending up in the hospital. It doesn't matter how young or how old you are. being unvaccinated makes you vulnerable to this virus. So we strongly encourage the community to talk to your primary care provider, answer any questions that you have, but please go ahead and get this vaccine. It is the safest way for us to beat this pandemic and for us to be safe as individuals.
All right, Dr. Charles Chima, City Public Health Director, thank you very much for your time. Appreciate it.
Thank you so much.
Coming up, as we talk about COVID-19, the flu season is also right around the corner. How the South Dakota Department of Health is growing concerned about a double threat with the current COVID surge. Welcome back. While the COVID-19 virus is getting all the attention, another virus is lurking out there. The flu season is fast approaching KELOLAND. As KELOLAND's Tom Hansen found out, the South Dakota Health Department expects to be tracking both cases of COVID-19 and the flu at the same time. In fact, some people may face a dangerous combination of both viruses at once.
The flu season for people in KELOLAND begins in a few weeks, running from October to April. Over the past 5 years, South Dakota's averaged 39 deaths and 612 hospitalizations a year from influenza. According to the health department figures, last season the flu was blamed for just 2 deaths, and only 6 people were hospitalized, and there were only 19 confirmed cases.
That is not our norm. We do see about 10,000 confirmed cases every year with influenza, and so it's going to occur where we're going to have some folks that are going to be impacted with both COVID-19 and influenza at the same time.
People will be wondering, okay, I've been vaccinated against COVID-19. Can I get my flu shot?
That is a good question. And what I would say is yes, if you've been vaccinated against COVID-19, you can get your flu shot.
Clayton says you can get the 2 shots together at the same time, but he does recommend you get them in separate arms. As for people who come down with both viruses at the same time this fall, Clayton says they often have a harder time and face higher odds of ending up in the hospital. He says the mitigation efforts that almost eradicated the flu last year still work. Social distancing, wearing masks, and getting vaccinated will protect you from both the flu and COVID-19. Tom Hansen, KELOLAND News.
And Dr. Clayton says that they also noted an unusually high number of RSV cases over the summer, which does not bode well for the upcoming flu season. Well, that's all the time we have for today. For all the very latest on COVID-19 in KELOLAND and across the country, head to our special coronavirus page on KELOLAND.com. There you're going to find the daily updates from the South Dakota Health Department, along with the latest from surrounding states and national health officials. You can also find the coronavirus page under the News tab on our website. And be sure to join us again next week for more of what's going on inside KELOLAND. I'm Don Jorgensen. Thanks for watching.